Welcome to Rome. This is The Bittersweet Life with Katie Sewell and Tiffany Parks. Hello, this is The Bittersweet Life. I'm Katie Sewell.
I'm Tiffany Parks.
Tiffany in Rome, Katie in Seattle. And it's been a long time since it's just been you and me. We've had 3 weeks in a row of interviews, which
I know
is not normal.
No.
Why did we do such a thing? I mean, besides the fact that they were great guests.
Of course, of course.
Why?
Why did we do such a thing? Why? Because I was on death's door.
I laugh,
exaggeration. Yeah,
I-
I was very,
Yeah.
very sick. And not just very sick. I was sick for like a long time.
Mhm.
I had bronchitis, which, I was convinced was like going to be a very light case. And, went into the doctor. Just like you have, what they call in Italy, bronchitella, like the diminutive version, meaning like you have like a minor case of bronchitis. And I'm like, oh, rolling my eyes because I used to get bronchitis all the time. And then I stopped getting sick and I didn't get sick for ages. And so I thought, I was immune. I just had this, I had this hubris about it, just like I never get sick. And when you
Yeah.
start talking like that, that is when the universe decides to spank you. Um, and and I got sick. So, she said, "Well, you should probably get on antibiotics." And I said, "Oh, I said, do I have to? Like, can we do something else? Like, is there anything else? Like, because it's so bronchitis is often viral. Do we know that it's bacterial?" And she's like, "Well, all right, I suppose you could do some aerosol, which is a nebulizer, which Italians are very big on the aerosol. Like every family has their own aerosol machine.
Mm.
Um,
You sent me a
yeah.
picture of you with it. It's like what I would consider what Americans would call a vaporizer, maybe, but it has a nose attachment, like that you actually stick on your face, so you're breathing the vapor, the steam
Mhm.
straight into your face.
There's three attachments. There's a mouth attachment, a nose attachment, or a mask attachment that would do, I guess, both mouth and nose if you had your mouth open. And that's the most common one. I think the technical word for it is nebulizer, but yes, it's like a little machine that's motorized. You plug it in, and then there's a tube, and there's a little attachment, and you put the medicine in the little attachment, and that attaches then to the mask or the mouthpiece or nose piece, and then you inhale it. I think it's a very effective way to treat coughs and colds and more minor stuff. Although some of the like you actually can, there are antibiotics that are actually inhalable, but I didn't have any of that. I just had some like, a little bit of cortisone and a little bit of some other thing, bronchial medicine. And so I did that for a week thinking, I'm going to totally get over this and be back up and ready to go. I did feel like I was getting better. That was the annoying thing. I had all of this, not to be too TMI, but I had a lot of dark colored phlegm at the beginning, and that started to go away. It started to get lighter and lighter. And I thought, well, this means the infection's going away, and I never had a
Mm-hmm.
fever either. Meanwhile, Claudio got sick, and he got sick for a very short amount of time, but he was very sick with a very high fever for 3 days, which was fun for me because that meant I was sick and I was taking care of him and my son.
Right.
That was brilliant. And so I think what the big mistake that I made was I didn't give myself proper rest, especially when Claudio got sick. I'm going to the supermarket, I'm going to the pharmacy every day. I'm picking up Aurelio, taking him to school, taking him to karate, doing this, doing that. Plus, it's January. It's pretty cold. And so I just, I didn't give myself proper rest. And after about a week, I went back to the doctor. I actually went to a different doctor, and he's like, "Yeah, you have bronchitis." And I'm like, he's like, "You really should get on an antibiotic." And I'm like, "Do I have to get on an antibiotic?" And he's like, "Well," it was the same exact reaction that my other doctor had had. It was just like he really clearly thought I should be on antibiotics, but he was trying to humor me, I guess. And so he put me on this whole regimen of homeopathic remedies because he's a homeopath as well as being, a traditional doctor. And I was taking these homeopathic things. I mean, first of all, they cost a fortune. Not a fortune, but a lot. Because in Italy, if you have a doctor prescribe you medicine, it's almost free. It's like extremely cheap. But this is homeopathic, right? So it doesn't count. It's
Mm.
not going to be taken care of. So I'm waking up every 3 hours in the night to take these little sugar pills. I mean, they look like sugar pills. They taste like sugar pills. They're not sugar pills, but that's, they're like little, I don't know if you've ever taken homeopathic remedies. They're like little cap. I don't know even what you call them, like little beads of sugar. That's what it looks like, tastes like, and drops and this, and I'm taking all this different stuff. And honestly, that didn't work at all. And then I started to get a fever, and he had said to me, he said, listen, if you're not better by this date, or if you get a fever, come back in, you're going on antibiotics. And both of those things happened.
Mm-hmm.
So I went back in, he gave me an oral antibiotic. So we're now starting week 3.
Mm-hmm.
I start taking the oral antibiotic. I took it, I got really serious. I'm like, okay, I am going to rest. I'm going to sit on the couch all day. I'm going to have Claudio do the school pickups, as much as possible, or rely on the carpool. And I'm just going to relax and stay inside, be in the warm house. And I did not get better. And I still had a fever every day for a week, or
Mm.
for 4 days at least, 4 or 5 days. And I went back in. He's like, you still have bronchitis? Actually, it's gone down further. It's technically bronchial pneumonia now.
Jeez. You're like, you
Um,
told me to go on an antibiotic, and look, you made it worse.
yeah. Well, I mean, it's so weird. I mean, and this is, I mean, I know going on and on about this, but it's like, I don't know about you. I don't know about other people listening, but for me, like whenever I'm sick, I always feel like I don't know who to trust. And I'm not to say I don't trust doctors, but doctors are only human too.
Mm-hmm.
You know what I mean? Like, I don't know if I should trust myself. I don't know if I should trust them. Like, and even throughout this whole situation, like, I don't know if it was the antibiotic that worked. And even the doctor said after I went in, after I took it, because long story short, I took a second, I had to go on a second antibiotic injection that was super, super strong, and a super strong cortisone pill, steroid, basically. And that did the trick. That did the trick finally. But when I went in to see him, so it's been a month now, right? And I'm
Mm-hmm.
and I'm significantly better. He said to me, he said, I don't know that it was the antibiotic that did it. It might just have been that, the illness finally ran its course. He says,
Goodness.
we don't know. We're not going to know.
Well, and
So,
and you got on tonight, because it's nighttime where you are right now in Rome,
yeah.
daytime here in Seattle. And the first thing you do is hold up your hand and show me that your fingers, for whatever reason, have turned brown, which,
The inside of my fingers, like the palms of my fingers, the skin is very, very dry, which is not new. I have very dry skin in the winter, but it's also brown
so if
and
any of you
splotchy.
are, any of you listening are doctors, I told her maybe a phone call would be
It's weird.
worthwhile.
Yeah. Yeah. So I really feel like I've been through the ringer here.
Yes.
I have a lot of more compassion. Not that I didn't have compassion for people struggling with chronic illness, but like I really feel it more. I feel for people who are going through stuff that is way, way worse,
Mm-hmm.
way 100,000 times worse than this. Cancer or other terminal illnesses where they're just trying everything, and they're trying to find something that works, and they can't. I can only imagine
Mm-hmm.
how maddening and frustrating and disheartening that must be, because I know that eventually I'm going to get better. That I
Mm-hmm.
am relatively young. So a case of pneumonia shouldn't put me into my grave, hopefully, knock on wood.
Yes.
But there are a lot of worse things out there. And so I'm actually grateful that it was just this.
Yeah. I have questions. I have questions.
Yeah.
Okay. So I couldn't find this article, unfortunately. But a number of years ago, I read a great article, and I should have saved it, that was about how the messages that are telegraphed to us by the way that medical clinics and doctors' offices are decorated, and that each country sort of has their own aesthetic. And of course, I know it's been a long time since you've lived in the United States, but I would say that the US aesthetic for medical clinics is sort of a pastel vibe.
Mhm.
It's light teal and pink and light blue, with nature scenes maybe, and non offensive furniture. And if we're really lucky, if it's a particularly magical clinic, it has a fish tank in it. And, and, all of this is, I suppose, to project calm. But what this article was also saying, and I wish I could quote it directly, was that it's almost like the aesthetic fulfills the expectation. Like, I am comfortable going into this medical clinic because it resembles medical clinics I've seen in the past. And so it was saying, you might have to go to the hospital or to a medical clinic when you're traveling abroad or living abroad, and you could feel distrustful of it just because of the way it looks. Like if Italy decided it was going to only decorate in yellows and bright reds or something, you would think something's wrong here. This isn't the normal, calm, pastoral aesthetic I'm used to. So I was curious, what would you say is the aesthetic of these clinics since you've now been in them so many times in the last month?
Um, I don't think there's really one through thread. Like I really think they're all different. They're very utilitarian. Like
Mm-hmm.
a lot of times there's no decoration at all. There's no, it's just like white walls,
There's
you
no
know.
Anne Getty's calendar with like babies sitting in fruit,
Mm-mm.
things like that.
I'm not going to say that there's never any decoration, but at the hospitals to me are very basic. Now, of course, there are going to be more expensive hospitals, there's going to be more basic hospitals, there's private hospitals, there's public hospitals, but so many of the hospitals in Italy are just, I mean, really run down. Some of them are nice. Like there are a few quite nice ones, particularly one of the more modern location of the sort of famous children's hospital in Rome called Bambin Gesù. There's like the old version which is up on the Janiculum Hill, and then there's the another location in Ostiense which is more modern. And that hospital is quite nice, especially the lobby area, very open, very sort of, modern architecture. But so often, I mean, they're just kind of depressing, like kind of almost scary.
Mm-hmm.
Um, I think that the typical American, especially if they're used to private clinics, going into a typical public Italian hospital might be a little bit freaked out.
Mm-hmm.
Not that the care isn't as good, it's really the aesthetic, like you're talking about. It's just like if you get an old enough hospital that hasn't been spruced up in a while, it can really feel like almost third world.
Yeah, I do remember that because I of that concussion I so awfully
Mm.
got when I was living there in 2013. I do remember going to the hospital there for that,
Did you
and
go to the one in Trastevere right by your place, Regina Margarita?
I went to the one on the island,
Oh, okay.
which is called what
Okay.
again? The
Fate bene fratelli.
Yeah, so there's a hospital that exists in Rome that's on this little tiny island that's in the center of the Tiber River, and right across from a coffee shop, helpfully, for those people who are bringing someone in,
Everything is right across
and a
the
church.
from a
So
coffee
yeah, if
shop.
I die, you
And
can just take
everything
me
is right
right across the
across from a
street.
church.
Yeah, but I do remember it feeling both extremely dark and also very fluorescent. I don't know how you could put
Mm.
those two together. And I also remember there was a lot of people on cots in the hallway. Like there
Oh,
wasn't anywhere to put anybody.
right.
But it also is a hospital that exists on a small island in the middle of the Tiber River. So I had no idea, is this the aesthetic or is this, just the fact that this hospital is ancient and clearly outgrowing itself? Who knew?
Yeah.
Well, I
Yeah,
mean,
probably
so
both.
if you could go back in time and think back to the younger Tiffany who first moved to Italy, did it take you aback when you first encountered this system that didn't look like at least what you grew up with?
Um, Maybe a little bit, not a ton though, because I had spent some years in Boston when I was like making no money. And I remember going to sort of like the very, very inexpensive public hospital when I guess I broke my wrist and I was between jobs. I didn't have any health insurance. And so I went to the went to the cheap hospital and waited all day in the emergency room. And I remember that that was not very nice. It was not that far of a road from the kind of thing you see in Italy. So I experienced some of that already. And I
Mm-hmm.
mean, I'm trying to think if I've ever been to any other hospitals in any other part of the world. I know I've been to a private clinic in Thailand. Not for me. I think I was traveling with someone and he, for whatever reason, needed to go to the clinic. And I don't think it was any kind of emergency, but for
Mm-hmm.
whatever reason we went, and it was extremely nice. Like it was nicer than anything I've ever seen in the States. It was super, super fancy and nice and modern.
Wow.
Um,
I went to one in Mexico when was suffering from heat stroke or heat rash or whatever. I forget what the actual diagnosis was, but it was very painful. But I went to a small clinic, and what I remember most vividly about it was a single room. It was like a little house, but it was just like one room. And the doctor, when he left the room, I have no idea where he went. As far as I could tell, there was nothing else in the building. Like maybe he just went and stood in, outside for a while. Well, as if he was, I don't know. But
as if he was in his office.
yeah, it was just like this very tiny place. And I was attended to by his daughter, who looked like she was maybe 12. So it was
Oh
like
my God.
those two together, and they did give me a shot of something in the butt. I have no idea what it was or if it did anything, but that was my experience. It wasn't. They were very friendly and warm. It wasn't that I felt like, oh, these people don't even seem like doctors. Although, it is weird having a 12-year-old attending to you.
Was she doing like nurse duty? Like was she
Yeah.
like taking your blood and giving you the shot and at 12?
No, I believe her father gave me the shot. But she was
Okay.
acting as like a little nurse. Yeah.
Oh
Yeah.
my God.
Yeah, but it wasn't. Yeah, they were certainly friendly. They definitely seemed competent, but I don't know. I don't know. Well, I mean, talk about that to a certain degree. Of course, here in the United States, we don't want to get in too far down the road about how complicated our medical insurance system is, with all the different private companies we can work with and all the different private hospitals, and how there's all sorts of different hospital chains, and you can go to this one, but you can't go to that one. And depending on what your insurance is, you can cover this and not that, or this and that, or whatever. Forever changing depending on where you get it and what level of insurance it is, I guess, how much you can afford or how much your company can afford. Not getting into all of that. But of course, it has
Okay.
been a long debate in this country, where some people think, no, we have to keep it privatized. This is how we have decent hospitals. This is how we have. And then we have the other people who are like, for goodness sake, other countries socialize this. We pay for it through our taxes. Why are we tying ourselves to our jobs to try to get insurance so that we survive? It's not fair. And the debate and the argument just goes on and on and on, as do the reasons why things do or do not change. But you live in a socialized healthcare system, and
Mhm.
as do many expats. I mean, we can wax poetic about it over here as much as we want. We don't really have any real experience with it. What is the reality of it?
So it's definitely not the perfect system. I don't think the perfect system
Ah.
exists. I know. I love to argue, like, especially if I'm talking to conservatives, sorry, mom, like about, how much better it is over here, because we have socialized medicine. And there are, trust me, a lot of benefits, a lot. Like, you don't lose your house because of medical bills ever. That doesn't happen. That's not a thing. You don't go into debt over medical bills, almost never. But, you know, there are drawbacks. So I will say up front, just you know, to say my final thing at the beginning, I do think it's better. I do
Mm-hmm.
think the Italian system is better, all things considered. Even if you consider all the cons, I still think it's a better system, personally. But there are cons. And for example, like I have to have an appointment with a pulmonologist. Is that the word, Katie?
I
A
don't know.
lung doctor. I have to have an appointment with a lung doctor. Okay. And I have a CAT scan of my lungs, and I have to have a lung doctor look at it, make sure everything's okay, and yada, yada, yada. And kind of give me the all clear, so I can sort of really fully re-enter life and start living normally and working out and doing my normal activities. And I called the hospital nearest me, just to see, when's the next appointment for a visit with a lung doctor. And they're like, it's June. Okay. And so this was in late January, early February. I'm not sure. It was either late January, or early February. So June would be the earliest time. And I said, okay, well, what if I go? I'm trying to think of the expression. It's privato sociale. Privato sociale is, and I don't know the exact definition of it, but it's some kind of in between, between being public and private. It's like the doctor is an employee of the hospital, but like they have separate hours where they're allowed to see private patients at the hospital. Does that make sense? It's a
Yeah.
sort of in between. And it costs less than going to a private doctor like at their clinic, at their private clinic if they have one, but it's not free. And nothing is truly, I'm not saying nothing is truly free. You usually have to pay what they call a ticket, which I guess is sort of the equivalent of a copay, but it's not through insurance, so it's not really the equivalent of a copay. When you go to that, like if you have an appointment, um, truly public appointment with a public doctor at a public hospital or clinic, you do have to usually pay something. But it's like it might be 15 euros, it might be 30 euros, it depends on what it is, but it's not very much. And the rest is covered. So that's the cheapest way. And then there's this, like I said, this sort of middle version, which I believe is called privato sociale. And then you can just go private. And I asked, well, do you have an appointment that's this diritto or this privato sociale? And they said, yeah, April or late April. Still too far away. And so when I went to the doctor, he said, and I told him this, and he said, yeah, you're just gonna have to go with the private doctor. You mean you can get an appointment tomorrow if you go with a private doctor. So I actually haven't booked the appointment yet, and I can't tell you how much it's gonna be. But from my experience, when you go to see a private doctor, a specialist, I'm not talking about like really crazy stuff. I'm not talking about really extreme cases. I'm talking about something like this. Like I've had bronchitis, I've had pneumonia, I need to go to a lung doctor.
Hmm.
How much does that cost? Or when I was pregnant and I would go to see my gynecologist, how much does that cost? It's usually around 130 euros, like 130 to 160, I would say, is a
Hmm.
typical price. Maybe 180 is like the typical price for like a one-time specialist visit, private. So it's annoying when you pay taxes for public health care and you nevertheless have to go and have a private appointment. However, 180 or whatever it is, it's affordable. It's quote unquote affordable. It's not going to be affordable for everyone.
Hmm.
But it's also not going to cause you to go bankrupt. So, a lot of Italians complain about this and they say, oh, we have this, we pay all of our taxes, especially people who make a lot of money and they pay a lot of taxes because, obviously you make more, pay more taxes. And then, I still have to, go to the private doctor, or I know people who have insurance, who actually have health insurance. Most Italians don't have health insurance, but it's becoming more and more prevalent because the healthcare system is starting to break down and there's starting to be more and more problems. And I think one of the big problems is just the population is just aging.
Hmm.
There's
Yeah.
just so many old people in Italy, and so and Italians kind of, and it's a stereotype, but it's true. Italians like are kind of obsessed with health, and especially the older generations, like they love going to the doctor and they love like, having appointments. And I think it's honestly like their hobby once they're like retired is dealing with all of their doctor's appointments. And so I can see how a public system would get overrun, and would get bogged down. So it's clearly not perfect. And, some things end up costing quite a bit of money. Like I had to have some blood work done, and the tests were like very, very specific. They were kind of weird things that are not typical. And in fact, the doctor said, before you go and get this done, call the clinic first and make sure they do it, because not all clinics do these particular tests. So I called a clinic that I usually go to, and they're like, "Yeah, we looked, and we actually do this one really rare thing. Like we can do it, but the total price of all these analysis is going to be 250 euros."
Mm.
And to me, that's a lot of money for blood
Sure.
work. I mean, I felt like that was a lot.
Seems like a
And
lot.
so yeah, and so I was like, you know what? I'm just going to go to the hospital and get it done there. And so I got my official doctor to do the official prescription. So like you can have a prescription on a piece of paper from a specialist or from a private doctor. That's enough to get your prescription. Like the pharmacist will give you the medicine, but they won't give it to you with the special discount that you get if it's done by your primary care doctor. So everybody in Italy has a primary care doctor who they can see for free. That's one of the huge benefits of the Italian system. Everyone has one. You usually pick someone who's in your neighborhood. You have to go to like the health office in your district. You go to that health office and there's like a list of all the doctors in your neighborhood and the addresses where their offices are. Obviously, not all of them are going to have space, but whichever ones have space, then you just pick. That's your primary caregiver. And if you don't like them, you can change. I've changed like a dozen times.
Mm.
Um, and you can go to them as many times as you want during their office hours, and you do not pay ever. But they're not specialists. Like, so they might say you need to go see a lung doctor, but they have the ability to create prescriptions for you that have like a code in which you take it to the pharmacy and you pay very, very little for the medicine. And the same is true for blood work. If you need blood work and your doctor writes you a prescription for it, you take it to a public place like a hospital and you get it done for much less. So I got her to make me this thing, and I went to the hospital and I waited in line. It was like an all day affair, the traffic to get there, the parking, and then waiting in line for an hour, just to
Uh,
pay. And I get up to the desk. It's finally my number is called. And they're like, "We don't do this. Like, what is this?" Like, I didn't think to call the hospital. I just assumed that the hospital would do it. And they're like,
mm.
"Sorry, we don't do any of these analysis." So I had to leave. I had to go to the I had to
Back
go
to
to
the
the
clinic. Yeah.
to the clinic and pay $250.
Uh,
So, it's not a perfect system. But on the other hand, giving birth is free. You have your personal doctor, and all children have their own pediatrician who they can see and as a parent, that is gold. Knowing that you can go to your pediatrician anytime and it will never cost you anything.
hmm
And like people talk about the lines, the waiting is not bad. I never wait to see my doctor. I just walk right in, or maybe wait 10 minutes, 15 minutes. Pediatrician, maybe a half an hour, 40 minutes.
Do you have to call ahead of time? Do you have to make an appointment, or you could just
No,
drive there and walk in the door?
you can walk in.
Even
But
that
they,
you could get in that fast blows my mind a little bit.
yeah, you have their office hours, and it's usually like 3 hours in the morning every other day. And then on the other days, it's 3 hours in the afternoon. So it's not like all day. You have to look at their schedule and you have to make sure, like, they're there. And, I have waited. I've had different doctors that they had too many patients, and I've changed because of that. So the more patients that they have, the more money they make. So,
Oh, see, this was something I was going to ask you about because, of course, here in the U.S., even from when you're a little kid and you're thinking like, "What are you going to do when you grow up?" and you're like, "Well, the best two things I get paid the most if I'm a doctor or a lawyer,
mhm.
I got to be a doctor or a lawyer so I can get paid the most." And you know that from like the time you're a kid. Is that the
Yeah.
same in Italy
Um,
under
m- I-
socialized healthcare?
they're definitely considered good careers. They're considered well-paying careers, but they're not as good as the States. You might make double or three times what like a typical job might pay, but you're not making 10 times, you know?
Mm-hmm. Mm-hmm.
And I think especially in the case of lawyers, you have to pay your dues. Like you have to work for nothing almost for like several years before you start making real money.
Hmm.
And doctors, I honestly think doctors is the same. Really they work a lot. They work a lot. So I don't know that it's worth it. I mean, I guess it's worth it if that's your passion. But I don't think that people become doctors here to become rich. It's more
What
unless
what
I mean there might be a subsection of doctors who like, work in very exclusive clinics like fertility clinics or plastic surgery or stuff like that. But your typical doctor I don't think is raking the money in.
what do people do to rake the money in there?
They
What
don't. They don't.
what is
Nobody's raking money
what
in
is that
Italy.
yeah, I'm
You,
like
you, you, this is how you do it. This is how you do it. You gotta be the child of a business person. That's how you do it. You
mm,
be the child of the Ferrari family or the Berlusconi family, or that's the way, the Armani family,
yeah,
Valentino. Those are the only
luck
people
at
who have
birth.
real money.
Luck
Yeah.
at birth. Okay.
Yeah.
Katie here. Picture yourself in the heart of Rome, not just seeing the iconic landmarks, but experiencing the hidden corners of this ancient city, away from the typical tourist crowds. It's true, with everything happening in the world right now, you might be wondering if it's worth the risk or the crowds, especially with the Jubilee bringing more people to Rome in 2025. But here's the secret. If you come on the Bittersweet Life Roman Adventure this October, you won't find yourself on a tour of the overcrowded spots. This is an exclusive, personalized journey through Rome's most secret corners, places where few have ever ventured. Now we know there are concerns. With the Jubilee bringing more travelers to the city, hotel prices in Rome have skyrocketed this year, and they'll probably just keep going up. But here is the good news. We're taking care of that for you. We are absorbing the rising costs so that you don't have to. You'll stay in a carefully selected, luxurious hotel right in the heart of Rome without having to pay the premium that most others will. And each morning, Tiffany and I will lead you through the city to see the real Rome, places even most locals don't know about. Imagine strolling through ancient streets, standing in awe of secret churches, hidden piazzas, breathtaking views, all while avoiding the busy crowds. And when the afternoon rolls around, the city is yours. Every afternoon is completely free for you to explore on your own. But don't worry, we've got your back. You'll receive a special booklet packed with insider tips to guide you. It's your personal roadmap to the best overlooked museums, the most incredible food, and self-guided walking tours that will let you dive deeper into the soul of Rome. This is your chance to explore Rome at your own pace, without the stress of planning or missing out on the real treasures of the city. The world may be in a bit of chaos right now, but Rome is waiting for you, with open arms and a quiet, timeless beauty that's just waiting for you to discover it. We're going to Rome October 5th through the 11th, 2025. You can find details at our website, thebittersweetlife.net, or just send us an email, bittersweetlifepodcast@gmail.com. This year, we are only offering 8 rooms. It will be a small, intimate trip where you'll get to know Tiffany and I on a more personal level, and you'll get to see the most wondrous things. I hope you decide to come.
I do want to say one other thing, and that is that if you have major medical problems, if you have cancer, if you're born with a heart condition, and a friend of mine, her son was born with a heart condition, so I have some like secondhand knowledge of it, you are taken care of. You are going to be fine. I mean, not that you're going to be fine because you're sick, so you might die. But as far as what the doctors can do for you, they are going to do it, and you are not going to be paying hardly anything. If you have certain medical conditions, you get what they call esenzioni, which I guess means like exemptions. So you don't have to pay for visits that you would ordinarily have to pay for example. Yes, I would have had to wait 5 months or 6 months to get a visit with a lung doctor because I'm not in any immediate life peril. But if I had cancer of the lungs, obviously I would be able to get in immediately. So that's the other really great benefit of the Italian system is that if you are truly in a dire position, you are going to be taken care of and looked after. You're not going to be sucked dry of every penny you have because you have cancer.
But never a fish tank in the lobby.
No, never.
Well, what's next for you? I mean, are you feeling like you can get back to life now?
I think so, although the doctor said, like, you can't work out until you've seen the lung doctor and, like, he gives you the all clear.
Okay.
And he doesn't want me spending too much time out in the cold.
Right.
Which I get because I was out in the cold the other night and I felt it. I really felt it.
Okay. But as far as you know, you're going to be able to, like, appear on this show regularly for the...
Yes, I'm back. I'm back, everybody. I am back.
With us airing the old episodes on Fridays now, which for me has been a total delight to listen back to some of those. At least you have been present. Even though in my life, I'm here in the Bittersweet Life offices, like walking in circles, being like, when is she going to return? Answering
Thank
emails
God for
lonely.
antibiotics, right?
Yeah. Answering emails all lonely by myself. The rain on the window, streaking
Oh,
sideways. Yeah, great to have you back.
thank you. It's good to be back.
All right, well, we'll leave it there for now. You can always reach this show and send us your topic ideas. Just write to bittersweetlifepodcast@gmail.com. We are also on social media. You can always follow us on Instagram. Just look for the Bittersweet Life podcast and you will find us. Give us a follow and we'll leave it there. And until next time, this is the Bittersweet Life. I'm Katie Sewell.
I'm Tiffany Parks.
Join us again. Bye. If you love the show, help spread the word to others by giving us a quick 5-star review wherever you listen. We love reading your comments and compliments. They are like fuel to the work. Thanks for taking the time.